He does a lot of procedures. He is fantastic. He offers the patients a lot of options. One of the options that he does offer is the Pinhole Surgical Technique. He's a certified pinhole clinician, and so let's start off with, you're very established.
Thank you.
You offer the patients a lot of treatments. You were doing grafting and tunneling and everything. So why did you become pinhole certified as well?
Well, as a periodontist, we are looked up to by general dentists to provide the latest techniques, the highest level of care, periodontal care for their patients. So in many cases, when there are situations or cases that they cannot treat themselves, we are the one who we have to help the general dentist. So most of the cases that we get, they're either very extensive cases or full mouth cases that the patient has been dealing with for a long time. And I always believe that as a specialist, I need to know all the techniques possible to treat the patients in the best manner. So if I only have one technique to do the treatment for a particular disease, I might not be good enough for that patient. So in order to provide all the possibilities, I need to know all the possibilities in the highest level. So because of that, I decided to, and also another reason was that about 2 years ago when I started learning about the pinhole technique and getting the words out, I noticed that there are more and more patients who are coming to us and asking about the pinhole technique, and I felt that it would not be fair to the patients. If I want to say something about the pinhole, I need to know inside and out about the pinhole. That's why I decided to join Dr. Chow's classes and see what I could do best for the patients.
Fantastic, fantastic. So you're very skilled, and we have a number of cases here that we're going to, Dr. Markzar is going to share with you on why he did the pinhole, how he did it, what the result was. And so let's bring one of these up right now. Let's cue this up right now. Here is one of your cases, Dr. Markzar. The upper left photo is the before, is that right?
That's right. Actually, let me tell you something.
Sure.
This is my very first case that I've done.
Wow.
And I chose it to be, maybe it was not a good choice, but I chose it to be a full upper arch case. And as you see on the upper left side of the screen, it shows the patient has a generalized type of recession. That means almost all of the teeth on the upper jaw and lower jaw, they have recessions. And patient had gone through several consultations, and she was really scared of doing something because everywhere that she was going to, they were offering her have multiple grafts, like 6 or up to 8 sessions of grafts, and she said she's not happy about having that. So when I told her that this is a situation, and this patient was referred to me by a prosthodontist, which are specialized in crown and bridge and very technique sensitive type of procedures, and they're very exacting doctors. So they want specifically, for example, the gum line to be in some places, and we have to be able to provide it to them. And that was a very challenging case for me to take as a first case, but I'm very happy that I took it because I learned a lot from this case.
Now you mentioned 7 or 8 times grafting. We're talking about going to the roof of the mouth.
Yes.
7 or 8 times.
Yes.
And to
harvest.
Harvest the tissue.
Yes.
And stick it to where it belongs.
Yes.
So, and so your patients declined that offer.
Several times.
One of different.
She declined several times,
okay.
But also there are other options that we could use for the grafting, but not taking it from roof of the mouth. But again, we have to do several times of surgery, and patients are very reluctant to do such a thing.
Right. Okay.
Excellent. So let's bring back up the photos for Dr. Markzar. He has his before, and then you have immediately after.
Yes, the picture on the right hand side on the top, it shows right after the procedure. As a first case, it took me 2 hours and 20 minutes actually, not 1 hour like Dr. Chow. And it took me that much time to release the tissue and bring it down. And another part of the specificity of this procedure, which I'm very happy about, is that for the fact that there are a lot of patients out there, which I don't know if Dr. Chow has mentioned that or not, but I see a lot of patients there that they have recession, and the recessions are temporarily treated by having a composite bonding on the root surface, and many doctors, they would decline doing a procedure or a graft procedure because it's a daunting task to remove all of those fillings from the root surface. And with this technique, with the pinhole technique, we can successfully remove all of those bondings and bring the tissue down to almost original position of the gums. And as you see on the lower left side, that's the one says a next day picture. This is the patient right less than actually 24 hours after the procedure. And we can see there is almost no swelling, and patient only had one Motrin over the counter, 400 milligram, and then she said she barely used ice packs because she fell asleep.
Yeah. So let me go back a little bit. Now, were you to do grafting
Yes.
on this technique? You mentioned that this took you a little bit over 2 hours.
Yes.
You used the pinhole technique. How many hours would you have had to take to do the grafting technique on this upper arch?
For the upper arch, probably about 3.5 to 4 hours.
For the
For
2
the
or 3
upper
times
arch.
you have to do it.
About 4 hours.
Yeah,
Yes.
for 4 hours. So it's longer if you do the other.
Absolutely. Yeah.
And then, would you estimate if you had to do the conventional grafting technique, what would be the number of pain pills that the patient would have to take, or including antihistamines and so on?
Most of the patients, they come with, when they come for surgery, they come with the notion that they have to take a lot of extensive medications, especially hardcore painkillers. And when I tell them during the consultation, when I tell them that with this technique they barely have to take few Motrins here and there, they get shocked, and sometimes they don't believe me. So it's very fascinating to go through the process of consultation and let them know that the technology is one part of the dentistry, but the new techniques which are coming along, like a laparoscopic technique, which basically I explain to the patient that the pinhole surgery is exactly like a laparoscopic technique of knee surgery or shoulder surgery that we do these days. And therefore, this is something that they look forward to instead of being scared of.
Yeah, right. So you would say that in the conventional circumstances using grafting techniques, you're talking about prescribing, maybe not your office because you have the pain under control, but you will say that you will need to be prescribing, or the doctor will need to be prescribing.
Yes.
Narcotics.
Yes.
And quite a few number of them.
Yes.
And including also antihistamine, right, to prevent swelling that causes pain.
Actually, it's very interesting because I was going back to the list of, when I was preparing for the meeting that we had tonight, I was going back to the list of the patients that I've done the procedure for, and I went through every single one of them. Not even one of them I prescribed even one codeine, which is a strong painkiller.
Yeah, wow, that's
not
phenomenal.
even one of them. So this is very
so
very
the
fascinating.
contrast is dramatic. One you have to prescribe
Yes.
some, and one you only, most of the time you don't prescribe any.
Actually,
Most of the time it's like over-the-counter stuff, right?
over count. Yeah.
They take
Motrin,
Motrin.
yeah.
So let's bring back up Dr. Markzar's photos and the after photo, 3 weeks after. Patient pleased with that result?
Patient was extremely happy with that, and actually she was in tears. She says she was very skeptical about this whole thing, and she said when she showed that to her dentist was taking pictures of her mouth.
So
that
the
was
referring
fascinating.
dentist was also pleased.
Yes, absolutely.
Did he cry too with her?
That I don't know. But actually, I got a phone call. I got a phone call from that prosthodontist, and he really thanks me for taking care of the patient, because he was dealing with the patients as well, and knowing that the patient was really scared and very skeptical about doing any type of grafting at that point.